Est-ce que tu as pu avoir le professeur Nyaï?
Toujours pas.
Bon, on va démarrer
D'accord.
en considérant que tu vas faire la présentation du professeur Nyaï.
Et
Elle sera
madame,
le directeur du, du projet MuniWASH.
mhm.
Donc, grande chose, pratiquement, bonjour à tous. Je suis Dr Siméon Khalifa, le directeur des programmes de l'association africaine, euh, partenaire euh, avec qui nous organisons cette session. Euh, Comme vous pouvez le noter, nous sommes à la Semaine mondiale de l'eau organisée à Stockholm et avec notre partenaire MuniWash, nous avons organisé cette session.
Partner WASH, we
Donc, le
organized
thème
this session,
est
the topic
tisser
being
des liens,
to
autoriser
establish
des
relationship
communautés résilientes pour des
and
services
also
d'assainissement durable.
make
Et
sure that
ce thème
communities
s'intègre
have
bien dans
sustainable water
le thème global
solutions.
de la semaine
And this
qui
was
consiste à
basically
des ponts
the global
pour l'eau
topic of the whole week.
un avenir pacifique et durable.
And we want
Donc,
to make
en
sure
rappel, le projet
that everyone has a
de la
sustainable
transition
access to water.
est un projet financé par
This is a
l'Institut
project.
pour le développement international, l'USAID, est mis en œuvre par Tetra Tech dans deux
This
pays
is
d'Afrique de
implemented
l'Ouest,
by
le Bénin et la
Tetra
Côte d'Ivoire.
Tech, Benin,
L'un
as
des
well
objectifs visés par
as
MuniWash est de
Ivory
capitaliser
Coast.
et de
And the
partager les
objective
connaissances
of
existantes
this
à grande échelle des
is to
solutions
basically
de
disseminate
développement éprouvées dans le
different
secteur de l'eau et de
solutions
l'assainissement. Et
in
c'est d'ailleurs
the
dans
area
cet
of
objectif
water
que
as well as
l'association
water
de l'eau
sanitation.
s'est prêtée comme
So
partenaire pour mettre en œuvre
it's very important
dans,
to be able to work together with
ce
the
projet
partners
afin de
in the
partager
framework of
à
this
grande échelle
project so that we
les
can
connaissances
basically scale up
acquises dans le
our
cadre de ce projet.
knowledge, all the knowledge
Donc,
that we have
pour animer
acquired in this
ce volet
area.
d'honneur que
So
nous avons convié
we have
le professeur Niaï
Professor
Turki, qui est
Nyai,
un expert dans le secteur de l'eau et
who
de
is an expert in the area. The interpreter is really sorry. The speaker's connection and audio is really bad. Sorry, the interpreter cannot hear the speaker. Jennifer, who is from USAID, is going to tell us and introduce us this session. So you now have the floor.
Jennifer?
Jennifer.
Safa?
Jennifer.
Oui, elle est connectée. Attends.
She
Attendez.
is connected.
Je la vois connectée.
I can see her being connected.
Je la vois
Ok,
connectée.
merci beaucoup. Est-ce que ça a marché? J'ai essayé
Thank
de
you
unmute.
very much. Is it working? I tried to unmute myself, but it didn't work. Hello, everyone. Thank you very much for this introduction. I'm going to be continuing in English, but I just want to, first of all, thank everyone in French for this invitation, and I'd like to also say hello to everyone on this occasion.
Okay, honestly,
So back
ladies
to
and gentlemen,
English.
it is a great honor to speak on behalf of the U.S. Agency for International Development. I welcome you all and express my deep appreciation to our implementing partner, Tetra Tech, who implements MuniWASH, and to the organizers for their invaluable efforts in making this event a success. USAID is one of the leading international development agencies, and we are committed to driving significant development outcomes. USAID supports nations across the world to achieve the sustainable development goal of universal and equitable access to safe and affordable drinking water for all by 2030. In West Africa, that means contributing to an enabling environment where people have access to the water and sanitation services they need to thrive, prosper, and build resilience. In West Africa, where a significant portion of the urban and peri-urban population lacks basic access to safe drinking water and sanitation services, USAID's regional mission is committed to helping partner countries develop robust systems for planning, financing, and implementing sustainable and equitable water and sanitation solutions. Through our water, sanitation, and hygiene, AfWASA activities, USAID West Africa focuses on strengthening the enabling environment by building the capacity of local, national, and regional WASH institutions, engaging the private sector in urban and peri-urban sanitation service delivery, and enhancing regional communication and coordination on WASH best practices. Our WASH programming in West Africa includes two flagship activities: the African Water and Sanitation Association Regional Institutional Capacity Building Program, which is called AfriCAP, and the Municipal Water, Sanitation, and Hygiene Activity, or MuniWASH. The AfriCAP program, a $6 million initiative, supports the African Water and Sanitation Association, AfWASA, a nonprofit organization based in Côte d'Ivoire, to facilitate regional coordination for WASH initiatives, harmonize policy, build stakeholder capacity, and disseminate innovative practices to improve the quality and sustainability of WASH services in the region. MuniWASH, a 5-year, $18 million initiative, works with municipal governments, national agencies, utilities, and service providers to expand and sustain equitable access to safe drinking water and sanitation services in urban and peri-urban areas of Côte d'Ivoire and Benin, with a focus on underserved populations. To address challenges in collaboration and monitoring, MuniWASH established a communal consultation framework in Bouaké and San Pedro in Côte d'Ivoire, creating an official forum for discussing sustainable WASH solutions. This data-driven approach has led to informed decision-making, resource allocation, and significant improvements in service provision. The San Pedro fecal sludge treatment receives more sludge and now functions at 80% of its total capacity. Since its inception, MuniWASH has enhanced the governance and management capacities of 16 municipalities, developed a sanitation market for low-income communities, and provided improved sanitation facilities to over 63,000 people. It has also mobilized nearly $2.85 million in new funding for the water and sanitation sectors and strengthened 82 sanitation enterprises in targeted municipalities. I would like to extend my sincere thanks to our speakers, Père Nyanye and Monsieur Morikunade Touré from Bouaké Municipality, who will share their insights on today's theme, Forging Connections, Empowering Resilient Communities for Sustainable WASH Services. Finally, I would like to reiterate my gratitude to our organizers for their dedication and efforts in making this event possible. Merci beaucoup et bonne journée tout le monde.
Merci beaucoup, Madame Jennifer, et merci également pour tous les mots.
Thank you very much, Mr. Jennifer, and thank you for all these very encouraging words that you just have said, also directed to the partner, the implementation partners of this project, of this WASH project. So now,
l'attention que ce programme porte sur le secteur privé.
We noted obviously that the
Et donc,
attention that this
selon,
project has
dans la suite,
on the private sector. And
la
now we're going to
présentation
be
du
listening to
professeur Niang.
the presentation of Professor
Sera
Niang.
le témoignage
Then
de
we're
Monsieur
going to
Touré
hear
de la
from Monsieur
municipalité de
Touré
Bouaké.
from the
Et,
municipality
nous
of
allons
Bouaké.
ensuite, pour terminer la série des
And
interventions,
in
écouter
order to
Madame
finish this
Adisoda,
intervention, we're going
qui
to
est
now hear
directrice
Madame
d'accès
Adisoda as well, who is
MuniWASH,
a joint
qui va
director to this
parler
MiniWash
de
project,
l'intégration
and who is
déjà
going to tell us
dans
about the
ce programme.
integration
Sans tarder,
of
je laisse
this
la parole
program. So
pour
now,
la présentation
without
du
further
professeur
ado,
Niang.
I'm going to give the floor to the Professor Niang.
Professeur,
Professor.
Ok, merci, monsieur le modérateur. Vous m'entendez?
Thank you, Mr. Moderator. Can
Ok.
you hear me?
Merci,
Yes, very well.
Dr. Simien, Contact modérateur.
Thank
Merci
you
à tous les participants.
to the coordinator. Thank you to all the
Il m'a été demandé
participants.
de faire une présentation dans
And I was asked to deliver a speech
cette session qui
for this
porte sur
session
tisser les liens, automatiser
in
les
order
communautés
to
résilientes des
basically
services d'eau et d'assainissement.
create
Et nous
connections,
pensons que,
automatize also
ces liens-là peuvent
these
se faire
different
à
activities
travers la
for
mise en
water
place
sanitation
du
and
fonctionnement des
basically
cadres de concertation
create
formales
connections
de l'approvisionnement
for
de l'assainissement.
these
Nous allons parler du cas
initiatives.
particulier
And we talked about this particular case, Bouaké, namely. So our presentation today starts with a small introduction. We want to present the methodological approach. We want to also talk about everything that was implemented in order to reach the results and which results we reached. I will tell you about some of the challenges we met and then the lessons learned. So, as an introduction, access to water, sanitation, and to drinking water is very important. It's an area that is crucial for the households. We have a local approach that we adopted so that we can guarantee access to these different services. So at local level, even at community level, we need to have institutional frameworks and decisions to be taken so that the institutional framework be basically fed by an exact knowledge of what's going on the field, and just making sure that the municipalities are going to take the right decisions on the base of the available data. Slide. Slide. So, why here at San Pedro and Bouaké? Well, San Pedro, because we have a sanitation station for fecal sludge that was recently built. We implemented some elements that have to do with the value change, and we also have a very well established framework. So the community, the commune, is already there. Slide. So, in order to get there, what have we done? We implemented a framework, a formal framework. We also established basically a situation,
Nous allons donc publier ces
we
résultats
have
et
georeferentiation,
les faire
and we
valider
had a look
par
at where was the
Et
access
cette
to
base
the different services of water sanitation and drinking water. On the base of that, we then published and validated the results, and we elaborated a municipal plan for improving all this. What were the results? Well, since we implemented this consultation framework
à Bouaké et à San Pedro,
in San Pedro and Bouaké, there were some also laws that were voted, because at a municipal level, the way it works is that we have the prefect, we have NGOs, we have beneficiaries. So this consultation framework is going to basically join the stakeholders together, and they are going to report to the prefect. So that's why we voted these bylaws at municipal level for these two cities, Bouaké and San Pedro.
Pour que le cadre de concertation puisse fonctionner, il faut que...
So in order for this consultation framework to function, we need data, obviously. Then this is exactly what we have done. We did some georeferencing. We have some great tools that allow to do this. We also based our work on the studies that were done before. We also wanted to make sure that we really list all the problem areas everywhere where there were issues, and we then published this data. We presented the results. We also made a joint diagnosis in order to identify gaps as well, and then we collected data, these georeferenced data. So here, on this map, you can see, for example, the rate at which people have toilets available, access to toilet by the population between 0 and 20%. This is true for peripheric areas. The greatest part of the population has a rate of access to toilets between 30 and 40%. And then the central neighborhoods where you have all the shops and businesses, then you have toilet access to between 40 to 50%. So the needs are quite different depending on the areas and neighborhoods. So obviously we will need to adapt our responses to these different situations. Because if not, the problems will not be solved. Slide. So here we can see the situation of management, how the sewage treatment is managed in these different areas. We have also sewage stations, sewage street treatment stations, and we can see the flux. 63% of these deposits go to the sewage treatment station. Slide. In terms of drinking water, the same assessment shows the access rates the access rates by the households. So we can see basically the peripheral areas have a much lower access rate than the central neighborhoods, where we can see relatively high rates of access to drinking water. Next slide, please. So these different results that were reached in the framework of this consultation framework. So the results of this survey or study that we have done basically was very important. And on the basis of this, we managed to elaborate and identify the needs so that we can contribute also to the SDGs 2030 Sustainable Development Goals. We also put into place a municipal improvement plan for WASH and also an access to both drinking water and water sanitation services. So in the case of Bouaké, that was 1 year before the bomb. So some efforts have been deployed and also some investment funds that were mobilized. So basically, we're going to deploy a distribution network to guarantee the services of water sanitation. So this investment plan needs to be implemented, and therefore we implemented an environment that's favorable. And the weakest link, the strongest link, is the consultation framework. So we're talking about the head of the municipality. And for all these actors, they need to work together around the prefect so that they can bring about sustainable solutions and to solve the issue of water sanitation. Next slide, please. What were the challenges? It is true that we managed, as I said, we managed to deploy this process. Everything went well. However, we still had to overcome a few challenges. For instance, one of these challenges was a low level of resources from the municipalities themselves, a low level of their own resources. Some neighborhoods do not have distribution networks. So then, in this case, the municipality could strengthen the network in those neighborhoods. And in this case, we can have some help from the government. We can have some subsidies from the part of the government, but the weakness of our means cannot always fill the gap between the government subsidy and what else is needed.
la planification municipale, le domaine de l'AEPHA,
the problem of the AEPHA is that it is not so much of a priority for municipalities. And I think that the WASH initiative is going to help improve this. It's going to help convince the municipalities how important the issue of water sanitation is. We also have, unfortunately, not much engagement of technical services in the planning process, for instance. The technical service was not very well functioning in Bouaké, which was not the case in San Pedro, but that was one of the weaknesses. And we also realized that some households were not very willing to participate in some of the surveys or studies because some promises were not held or not kept. Now, what were the lessons learned? Today, we could observe in the different communities informal exchanges, informal exchange platforms. So we wanted to basically reinforce and strengthen these informal digital platforms. So this is an advantage so that we can enable communication among the different actors and stakeholders. And as I said, the implementation of this consultation framework was very much expected, and it allowed a communication around these issues of water and water sanitation. As I said, MuniWASH, the MuniWASH project was also very, very important so that the different actors and stakeholders could discuss these issues, even though there was a minimum of resources that was mobilized for this consultation framework. It was still efficient. So we needed to leverage so that we could really make sure that we mobilize all the different actors. If we use this leverage, well, then we'll be able to mobilize the necessary funds. This municipal improvement plan has to be implemented 1 or 2 years before. This has to be implemented via some municipal plans, municipal plan of annual improvement. So basically, this is a very enriching experience, and this gave us results that really strengthens what we did. Thank you very much.
Thank you very much for this presentation. Thank you for delivering all this information. Meets the requirements today, and what we have retained is that thanks to this consultation framework, which helps us forge connections, and we need to do so at a municipal level in order to establish WASH municipal plans, despite the hurdles we are facing due to low budgets available that you have so nicely highlighted. But we understand that this low budget can be recovered elsewhere, but we will come back to that in a while.
Monsieur Touré de la municipalité de Bouaké pour son témoignage. À vous, Monsieur Touré, vous avez la parole.
Would like to now welcome Monsieur Touré from the municipality of Bouaké. Hello, everyone. Thank you very much for welcoming me at this meeting. Like Dr. Nyanya has so nicely put, I must say that within this communal consultation framework for all sanitation projects has been met with great satisfaction. And so this allowed us to gather quite a number of actors. Related to these activities, we were able to strengthen capacity of different actors in place, of everyone who was using the geographic information system for data collection, and we were able to do a proper mapping, which was so nicely presented. And this was regarding all the water sanitation projects available for different households. Nevertheless, we have faced a few hurdles in its functioning. We have realized that from all the activities undertaken, we have managed to do a proper assessment of the access ratings to the water sanitation services. There were some challenges in its implementation. It was also highlighted that we were lacking leadership at a local level. Today, the collectivity is taking the lead, but in reality, today we are working with different entities, and so each one has its own objectives, and therefore it is necessary for us to identify a leadership within this consultation framework so that we can ensure a proper functioning and implementation of this framework. This is definitely a point we are focusing on, and we believe that if we did manage to vote for a leadership, we will be able to submit proper proposals to decision makers. And that was one of the challenges that we were facing when it came to implementing this framework. Also, we understand that certain collectivities are present, however, are limited in resources. In order to face the situation, you understand that the budget available is quite weak today. This sector, unfortunately, does not have enough funding in order to meet the necessary needs, and we need to put in place the proper strategies that can be in order to attract funding from all our partners in order to implement all programs within the improvement plan and provide water sanitation services for all households. We have benefited from a strengthening of capacity, but this needs to be continuous in order for us to strengthen all capacities for all actors, whether it be on a technical level or else, in order to properly identify the issue and offer the necessary solutions to provide water sanitation services to all the collectivities. We also are lacking a follow-up. The improvement plan has been established, but as I said, despite it being established, there is a lack of follow-up in order to take the right decisions that could improve the annual improvement plan. Also, we need to develop the regulatory framework, which today is retaining us from moving forward. Today, we are working with different entities, indeed. However, each entity is accountable at a different level, but we do need to have a proper regulatory framework that would define all the entities' roles within this framework, and this would allow us to work more efficiently, ensuring a proper coordination at a local level and meet the needs of the population. This is the information I can share with you today when it comes to implementing this framework. And if you do have any questions, I would be delighted to answer them. Thank you very much. Thank you very much, Mr. Touré. Thank you very much for sharing your views. We have understood your limitations, and we understand the challenges you are facing. The interpreter would like to apologize. The speaker's feed is very unstable. My apologies, the speaker is inaudible.
Nous avons écouté un témoignage et ce qui confirme ce que
we have welcomed this feedback, which confirms the presentations that were delivered earlier this morning regarding the data collection. It is certain that in order to gather sufficient data on water sanitation services in the area, which is a local issue, we will need proper budgeting in order to develop this service and provide proper data collection and accurate data collection.
C'est évident. Donc, voilà un peu, Monsieur Touré est disponible.
Mr. Touré stays available to answer any questions you may have. And now we are going to give the floor to Madame Adi Soda, who will share with us her reflections on the gender aspect when it comes to water management in the MuniWASH framework. Thank you very much. Thank you, Dr. Kelfak. Hello, everyone. I hope you can hear me clearly, more or less. Thank you very much. May I have my slides, please? In the meantime, I would just like to speak of the integration of gender and social inclusion and how this was considered in the implementation process of the consultation framework. Indeed, the Women's Association was represented within this framework. So we have two women representing the Women's Association that are presiding at the Technical Secretariat. And furthermore, We have a strong participation of women at the different consultation sessions. We have the regulation of WASH sector. We have the deployment of the sanitation brigade at a communal level. We have the appropriation of sharing of codes for water, sanitation and hygiene. We also recognize the impact of exploitation, mining exploitation, which is considered illegal on resources such as water and environment, and the prevention and management of risks of flooding. Next slide, please. When it comes to the elaboration and implementation of the water sanitation project and drinking water, this framework promotes the separation of public toilets for women and men, for example, in markets, in health centers, in schools, and train stations. This framework also underlines the reduction of difficulties linked to water access and sanitation services. This framework we understand that there are also proximity services and extensions of network, also the implementation of digital payment of certain bills and services. We can also speak of the easy access to women who are head of households to social deployment. So when it comes to speaking of the gender aspect, we understand that it is important to have them participate in consultations and implementations of projects. This is what I wanted to add to the presentation when it comes to including gender and social inclusions in these projects. Thank you very much. Thank you very much, Madame Adisoda. My apologies, the speaker is inaudible. The interpreter would like to apologize. We cannot continue with the interpreting services. Our speaker is inaudible.
Alors, il faut pas on est oublié ou bien on est des laissés pour compte dans
I have a feeling that we have been left aside when it comes to water access, and indeed the gender that is highlighting the role of women in this project is important. Women must be part of the consultation sessions, and we understand that when they are leading households, their voice is important.
Voilà un peu déroulé nos trois présentations et témoignages. Au-delà de ce que j'ai déjà résumé, je voudrais quand même noter
to point out
certains des problèmes ici posés
that some of the issues that have been laid down today when it comes to implementing CCC plan the interpreter would like to apologize. The speaker is inaudible.
Les financements, le secteur privé, voilà les axes sur lesquels nous devrions, dans la suite
we need to find financial resources in order to implement this plan. I would like us to decide on an important note that we can conclude on and agree on to highlight the main issues we are facing when it comes to implementing these plans and provide water sanitation and water access to the population. The interpreter would like to apologize. The speaker is inaudible.
Mais pour introduire les questions, laissez-moi quand même l'occasion de poser deux à qui voudrait
Before
répondre.
we welcome any questions from the audience, I would like to ask two questions. Maybe Simeon, can you tell us who are the main actors participating in the consultation framework, please? It is a matter of sharing information, and everyone needs to know that when we are establishing a consultation framework, I want everyone to understand who would be the main actors who need to be considered and who are the main stakeholders. Second question. My apologies, the speaker is inaudible. The second question could not be heard. We are developing strategies in order to attract further funding. What strategies have you put in place within this consultation framework? If you could kindly share your opinion with us in this regard. My apologies, the speaker is inaudible.
Et à la suite, je laisse la parole au public pour des questions.
I would like to ask our speakers to respond to these questions, and then we will open the floor to the online participants. Thank you very much.
Oui, merci au docteur Kenfak.
Thank you, Dr. Kenfak. When we speak of main actors, it will all depend on the country administration. In Côte d'Ivoire, for instance, in a commune, the administration actors within the regional framework are those who work around the prefect. They are the region chiefs or region. Yeah. And so when it comes to providing water sanitation, this is dealt by the regional water authority.
Ça va être, dans le cas de l'eau, la SODECI. Ça va être
comes to water and sanitation, it will be the Environment Authority and the Regional Department of Construction that will ensure proper provisions of equipment to put in place and to start enabling the right services. So the different actors as well are those who provide the water sanitation services. There are a few associations and NGOs available in the commune, and the municipality will also be involved. These are the main actors who provide the services and water sanitation services. All those who work with the prefect, the department prefect and regional prefect will be implementing the necessary requirements to establish the consultation framework. Now, when it comes to answering your second question in mobilizing the proper financial resources, my apologies, the speaker is inaudible. We have submitted the municipal improvement plan, and we have suggested different levels of investment in order to implement the project effectively. We have the possibility of mobilizing the resources. And when it comes to the consultation framework, I forgot to share that all IMFs are part of it. So we have decided to enable discussions, provide credit facilities to different households, and improve at a global level access to water and drinking water and water sanitation services. But we are looking at how the service providers can help. All this can be formalized within this consultation framework.
Je disais que les acteurs de financement vont être rassurés. Le cadre de concertation est une garantie institutionnelle, peut constituer une garantie institutionnelle.
And I was saying that the financial actors are a constitutional warranty, and we have the possibility to attract for the funding for an efficient implementation of the consultation framework and the provisions of water sanitation services.
Je pense que le cadre de concertation constitue une base très intéressante pour la durabilité de la fourniture des services d'assainissement aux ménages.
I believe that this consultation framework is an interesting basis for the implementation of the proper services. Thank you very much. Considering we have 9 minutes left, I would like to welcome one question raised by our audience. Can Stafa please tell us if our participants have maybe written a question in the chat box or in the Q&A section? Thank you very much. Indeed, we do have a question that was written in the chat box. Mr. or Ms. Water Witness is asking a question related to companies within the community that are producing cocoa, especially in Côte d'Ivoire. We are asking whether these companies have a social responsibility and if they are developing proper profits in the cocoa producing zones, and whether the water sanitation services have been properly implemented in these regions. It is more or less linked to today's topic. It is the only question available in the chat box. Thank you very much. Since we are speaking of different strategies in order to fund the proper development of our consultation framework, I would like to ask Mr. Touré if in Bouaké these companies contribute in a way or another to the provisions of water sanitation services. Monsieur Touré, could you maybe tell us if the cocoa production companies are contributing? I will first share with you that Bouaké is not really a cocoa production area. But if we try to link it to other structures who are generating profits, I must say that their participation is quite weak. As far as I know, within this sector, we have approached a few structures who had a communal impact and see how they could potentially support the implementation of a sustainable service of drinking water and water sanitation. But I must say that we are still facing a lot of difficulties. Professor, you raised an important point earlier. This sector is not really a priority. I mean, a priority wouldn't necessarily be the right word, but it is not an axis of interest of the major population. So I believe we needed to first identify these different structures and then see how they could potentially be interested to finance certain activities within the consultation framework. Thank you very much for your input.
Je peux intervenir sur cet aspect? En tout cas, merci à la personne qui a
Professor, if you'll allow me, I would like to thank the person who asked this question. Indeed, we have not really pinpointed the social responsibility enterprises or anything within this framework. For example, in San Pedro, we will be focusing on the cocoa production companies because we are a production site. But the consultation framework should consider these axes, and this should be part of the access improvement plan. And we can consult these companies and see how they could directly finance these projects. We had not considered these aspects, but indeed, thank you for pointing it out, because within this improvement plan, we could completely consider the integration of these companies, which could indeed consider part of their benefits, their revenue benefits to support these projects. So thank you very much. Considering the 4 minutes left, I would like to shortly summarize our exchange today. Considering the municipal administration, it is the right sector that can help improve the provisions of water sanitation services. What are the lessons learned of our discussions today? Well, the water issue needs to be dealt with in an inclusive manner at all levels, social level, economic level. Imagine a country built of different communes and areas, but each commune is part of this country, and we cannot decide that part of the country will be benefiting from water sanitation services or drinking water services and not another. The entire country needs to be benefiting from it, and the entire country will be providing the necessary data for us to establish the needs and the urgent needs. And we will also be establishing a proper funding plan. The interpreter would like to apologize. It seems that several microphones are active and voices are overlapping. The main speaker remains inaudible. The interpreter would like to apologize. The main speaker is inaudible.
De travailler là-dessus au niveau des États et de faire en sorte que la décentralisation du secteur de l'eau et de l'assainissement soit effective.
We need to make sure that the decentralization of the water sanitation sector be efficient, And we also need to make sure that all budgets allocated to water in all aspects be properly distributed for an efficient implementation of the consultation framework and of all water sanitation services. We need to consult with companies who properly manage the water aspect. And we need them to be proper stakeholders of the consultation framework to work efficiently hand in hand and collaborate.
Les acteurs les plus efficaces pourront se retrouver au niveau municipal.
We hope that all actors will be able to meet in order to lead this project successfully. I would like to thank you all for your kind attention, and now I hand over the floor to our colleague of USAID. Thank you very much. We have reached 11 o'clock. I would like to thank all the participants who joined us for these interesting discussions. And I would like to tell you we will be meeting you again to speak of this project further. I hope you will find this session enriching, and I thank you all for your kind participation. Thank you very, very much, everyone. We wish you an excellent day. Thank you.